What's up, everybody? It's Dr. Michael Mash with Barbell Rehab, and today we're going to talk about how to fix Achilles tendinitis. But before we get started, make sure to like this video and subscribe to this channel. That makes sure that our video gets to as many people as possible so we can help more people like yourself. So today, as mentioned, we're talking about Achilles tendinitis or Achilles tendinopathy and what to really do about it. But before we get into what to do about it, let's talk about why Achilles tendinopathy really occurs. And what it really boils down to is something called a load management error. Basically, you applied a stressor to your Achilles tendon that it wasn't prepared for. So maybe you started doing too much jumping or too much running too quickly at too high of a volume, frequency, or an intensity that you weren't priorly adapted to. We find this when runners, a couple examples would be when a runner gets back into season after taking a training hiatus, they may start at too high of a volume or too high of a frequency. Or maybe you just start a sport up that requires a lot of jumping that you were not priorly doing. So load management errors are usually the culprit for any tendinopathy or any tendinitis. So what do we do about it? There's a couple recommendations. First, we got to get it to calm down. You have to remove or modify the aggravating factor. So if the aggravating factor is jumping or running, back off on the amount of it you're doing. You may not need to stop it altogether, you just need to bring it back down to a dosage that your body can adapt to. So that's what you have to do. Step one, remove or modify the aggravating stimulus. And a big part about this phase is this: stop poking and prodding your Achilles tendon. This is an older method where rehab professionals back in the day, we were advised to basically get in there with our thumb, dig on that tendon to try and get it to remodel. But what we found is that not only is this extremely painful, the last thing you want to do when something is super sore or painful is poke and prod it. So not only is this extremely painful, it's not capable of actually remodeling the tissue. Think about it, if a thumb or some sort of metal instrument was enough to modify your tissues, that sort of is kind of scary because that says that our body is not as strong and resilient as it should be. So you don't need to poke and prod at this thing, you don't need to foam roll it, you don't need to rumble roll it. The idea and the current recommendation for treating Achilles tendinopathy is called treat the donut, not the hole. So what does that really mean? So think of the donut as your entire Achilles tendon, and think about the donut hole as the part of the tendon that is causing the issue. So treat the donut, not the hole, means that if you have an Achilles tendinopathy, it's usually only a small part of that tendon that has the tendinopathic changes. So instead of digging away and trying to get that donut hole to remodel, we want to strength train the entire donut or just start training and strengthening the tendon together as a whole. So again, treat the donut, not the hole. Step two, how do we really train the Achilles tendon? Especially in the early stages when it's a little bit flared up, you can use what's called mid-range isometrics. So basically, you're going to do a heel raise, but only through half of the range of motion, and then you're just going to hold it there as an isometric hold for 15 to 30 seconds for 4 to 5 sets, multiple times a day. It's been shown that when you hold or perform an isometric hold with a tendon, that this can actually have an analgesic effect and reduce pain. So step one, calm the tendon down with mid-range isometrics. Once the tendon's calmed down, we can then introduce more isotonic exercises where we can really start to load up that tendon and increase its capacity to accept and transfer load and weight. Two of my favorite exercises are this. The first one would be a seated barbell calf raise. This is going to really train that gastrocsoleus complex with the knee flexed. And then the other exercise would be a standing single leg wall heel raise. And that's going to really train the gastrocsoleus complex with the knee extended. So we're really going to train this Achilles complex at two different knee joint angles, one with a seated barbell calf raise and two with a single leg standing wall heel raise. You want to perform these with a slow tempo, 3-0-3, so 3 seconds on the way down and 3 seconds on the way up. Nice and slow, that's what's going to force the adaptation at the tendon level. So if you're dealing with Achilles tendinitis or Achilles tendinopathy, stop poking and prodding it. You don't need to go through more pain than you already are in. Use these mid-range isometrics to calm it down and then slowly build it back up with both knee bent variations and knee extended variations. Again, if you like this video, please like the video and subscribe to our channel. It helps us get in front of as many people as possible, and we wanted to thank you for watching.